Hi, I'm Tony Bova, and I'm a Wilson State College nursing student, and today I'm going to be performing my IV Piggyback skills. First things first is I am actually going to check my orders that my provider just gave up for my patient. And so my patient's name is Shirley Coast, and her date of birth is 5/14/1964, and she has allergies for methicillin and codeine. And then also on provider's orders it says Shirley Coast, date of birth 5/14/1964. And it looks like we have orders for sodium chloride at 1,000 milliliters at 100 milliliters an hour, and that's already infusing for the time safe or the video. And also we have also an order for ceftriaxone 1 gram for IV administration, 1 gram of ceftriaxone and 250 mils of 0.9% sodium chloride infusing over 60 minutes. And it also says on this one, ceftriaxone 1 gram for IV administration, 1 gram ceftriaxone and 250 mils of 0.9% sodium chloride infusing over 60 minutes. And it looks like everything is good as far as allergies, and it's just the antibiotic that we're going to be doing today as IV Piggyback. And so now I'm going to go ahead and I'm going to bring my order into the bedroom, and we're going to get our medication prepared for our patient. And so, okay, now I'm going to my bedroom, and I'm going to double check my medication for my patient. And I have ceftriaxone, and it's 250 milliliters infusing over 60 minutes in the ceftriaxone. The package is intact, it is clear, and it doesn't look like there's any holes in the medication. And so to prepare my medication, I'm actually going to put my medication label on there and making sure comparison with that. And so I'm going to put my hand hygiene and put my gloves on. Alright, then again, checking medication to my MAR, ceftriaxone, 1 gram in 250 milliliters of sodium chloride, and I have the same medication here, so I'm going to go ahead and open my bag. Okay, now go in the garbage, and again, it's clear, there's no holes, just double checking everything, making sure it's intact and ready to go for my patient. And I have a label here with the medication on it, and also for my patient, and double checking Shirley Coast. She's a 54-year-old female. Her date of birth is 5/14/1964. So we're going to put that right onto the medication bag, and also what the medication is. And we've got that prepared. And then I would make sure I have all the rest of my supplies, including my secondary medication set, which I'll be using to hang up the medication and put it into the pump. And so I would then take off my gloves, do hand hygiene, and next we're going to go into our patient's room, making sure to bring all our supplies and our orders. Thank you. Knock, knock, knock. Hi Shirley, it's Tony. I'll be your nurse today. I'm just double checking. Could you give me your name and date of birth, please? Shirley Coast, and her birthday is 5/14/1964. She has an allergy to codeine and promethazine. Everything looks intact. How are you feeling today, Shirley? Doing pretty good? Okay, well the doctor has ordered a antibiotic here for you, and so I have to get it set up, and we're just going to infuse it right into your pump. Okay, Shirley? Okay, perfect. So first things first is what we're going to do is I'm going to prime my bag of medication with the tubing I have set up here. Put this over so you can see it a little bit better. Put that tape on. Go in the garbage. Alright, and so I'm going to go ahead and open this part of the bag up, and this part of the spike. That's what will go in the garbage, and then I'm going to go ahead and I'm going to spike my medication. Okay, and then I'm going to turn it, we're going to hang it, gonna go ahead and fill my chamber half full. Close it. The chamber would be half full. Okay. Perfect. And then we're going to make sure that our line is primed by opening it up just a little bit. I have the garbage over here, so we're going to go ahead and do it that way. And we just want to open it up just a little bit to make sure that we don't lose enough medication or lose too much medication. Perfect. It is primed. Everything is still there. And then we go ahead and tap the line and make sure there's no bubbles. Let's set this right here. Everything is still connected. Perfect. And then my IV tubing. And then I make sure that to put all my information on there. The date, the time, my initials. And I also do the same thing for my labels on my medication. That. Okay, and then I'm going to grab my sterile alcohol prep pad, and I'm going to check my medications one more time to my MAR. And so I have the ceftriaxone, infusing 1 gram in 250 milliliters, infusing over 60 minutes, and it's the same thing on my label as well. And then I'm going to clean the quart for 10 to 15 seconds, making sure it's clean. And then we're going to go ahead and make sure this is closed still. Open our cover. And we're going to connect our secondary line. And then we're going to go ahead and set this up for the proper medication. I'm going to open up this part first. Okay. And then we're going to go ahead and we're going to press B. And then we're going to do picking our therapy. And then we're going to page down, it'll be closer, and we're going to go all the way down to ceftriaxone. Fantastic. There we go. And select that one. Okay. Alright. And we're going to do 250 milliliters. We're going to infuse the full 250 milliliters. And we have ceftriaxone, 250 milliliters. The full thing. And it's going to be completely over 1 hour. And so I'm going to go ahead and press the start button. And now you can see that the fluids are stopping while the ceftriaxone is infusing. And then I would go ahead and I would take my gloves off, gather all my supplies, and make sure I would do hand hygiene. I would go back and I would document the time I started the medication, what medication it was, the patient that it would be given to, if the patient refused it or denied it, and that would be it.